6:49. Let's stay in the Zoom room here and get on Dr. Vince Akimoto. Good morning, Doc.
Good morning.
Good morning.
Thanks for joining us. Wow, it looks lovely. Where are you at right now?
I'm trying to get ready to go to work, but had to comb my hair, so it's taking me some time. That's my hair.
Oh, I love that wind in your hair look this morning.
Windblown.
Yeah. Doc, so, man, you've been pretty busy. I know that there was a whole bunch of developments that happened in the last week, and you've been kind of making some noise about public health contact tracing. And so I guess we'll start there. Do you believe the Department of Public Health and Social Services is doing an adequate job of contact tracing these COVID-19 positive cases?
No, I think they're doing an incredible job. The very few people at the Department of Public Health who are qualified to do this very sophisticated medical detective work to track down the increasing number of positive people, especially those who are coming from overseas, from the mainland United States and from the Philippines. Those people are doing incredible work and have been doing it for the last 4 months, and many of them are exhausted. They have other jobs. Some of them are in charge of our tuberculosis surveillance program, our dengue fever program, our lab. They have other jobs, and yet they've been for the last 4 months single-handedly holding up our economy. And it can't continue in this way. So if the legislature and the governor are awake now, and if they're not, somebody should go wake them up. They should pay attention to Hawaii, because that's what happens when you fail. Hawaii made all these promises to its people and to its businesses that it was going to reopen to Japan. That ain't going to happen. They are now among the worst in the nation in terms of failing to control their borders. They have a greater than 200% rise in cases over the past few weeks. 2 more people died yesterday, and so they have almost 30 deaths from COVID-19. And this is terrible. Every death matters, particularly in a disease that some people say is just a bad flu. Mm-hmm. But the flu kills. And unfortunately, this is the bad news for today. It's flu season. We're about to get whacked by the flu. And dengue fever wants to start back up again, too. So if anybody thinks that we need to stay status quo with the public health budget, if anybody thinks that the government of Guam did a great job of keeping us safe and by having a hospital that fails accreditation and doesn't have enough ICU beds for this surge, they're idiots. And so every senator, every governor listening on Guam today needs to understand that we are now getting hit with the same surge that brought Hawaii down. We simply don't have enough ICU beds. We have tons of ventilators. We have tons of machines. We have tons of medicine. And that's a credit to some people that have been working hard. We don't have enough nurses. We don't have enough doctors. So if you want to open this economy, if you want to start giving people their jobs back and people going back to school, we need contact tracers. We need to do the things, the basic science things that have been working everywhere else. Don't make this up. You're not that good. Mm-hmm. You know, this hand washing and everybody staying home in place and acting like there's a super typhoon, you know, that's a great way to kill the economy and ruin our culture, right? Because, I haven't seen my mom in like 3 weeks. I told her 3 weeks ago that this surge was going to happen because of idiots coming from Hawaii, running around like they that it's their business if they go and kiss all the old people in the Tukis community. We have a really big problem right now because the people that are working are exhausted. And the legislature thinks that it's fine to keep a budget that funds 5,000 unnecessary people. I can't make this any more clear. You're an idiot if you think that your budget that you're going to fight over next week is going to save Guam. We need more nurses. We need more contact tracers. We need to have a more robust system that responds to schools that have positives in less than 1 day. You shut down a school that has 1 positive case because you can't get enough public health help in on that day. So, again, make it clear. The reason why all these businesses are shutting down, the reason why our economy is going to get bombed is because of the legislature's failure to prioritize public health, to prioritize education, and to prioritize public safety. They want to fund idiots. So again, I'm sorry about my hair. Is it still okay?
Yeah, your hair is great.
It shook a little when you said idiots, though. I felt that passion there. That was like a teeth gritter. You're like, idiot.
Yeah. Can you call some of the senators? Because I'd like to see if they peed in their pants. Try to put the camera right where they peed, because they think they did something great.
Mm-hmm.
They all sheltered in place. They confirmed that they're non-essential, and they let the governor and her people do all the work. And then they come in and criticize and start having all these oversight hearings.
Mm-hmm.
This is their time to shine, right? The budget hearing is the only thing we pay them to do. They control the purse strings. And they told us this week that they think everything's great. We're going to continue to fund everything. We're going to freeze all the positions, so we can't hire any more nurses. We can't hire any more contact tracers. And we're going to keep all the special project coordinators. We're going to keep the 200 people that GMH hired during this pandemic. None of them were nurses. There are 1,300 people on the GMH payroll today. None of them are nurses. Because if they were, I wouldn't be complaining about the fact that when we go through this weekend and we get 5 more ICU patients, if we do, right, and we've got lots of positives and lots of idiots walking around with breaking quarantine like they're not supposed to, right? And other people that are sick and are scared to get tested because they don't want to lose their business. Again, the government needs to step up. But our hospital didn't suddenly magically get better since March. Mm-hmm. Our hospital didn't suddenly become, so good that the governor was going to put any money in to renovate the elevators. She said it's hopeless to fix our hospital. Lillian Posadas, the hospital administrator, says she wants to build a new hospital, and she's given up on our current hospital. So how confident are you as we go through this surge? Hawaii is in tears right now. They're on their knees. Mm-hmm. Their ICU beds are quickly filling up. Their lieutenant governor, who's a doctor, is saying that they're going to need to shut down again for another month. Mm-hmm. Locked down, like the way it was before. Curfew, no businesses, no flights, no nothing. And this is on the back of the Guam legislature, which is doing a budget right now that's only there, I suppose, to keep their primo and prima in business, right? To keep them home watching Netflix. This is your fault, buddy.
Doc,
this is your fault because you can't budget for a pandemic.
Doc, I got to ask this because, you come on the air. I get some of your messages, and, what we get in response is a message from the Joint Information Center. And
Fake
it
news.
is, do not believe unverified information.
Right.
Yeah, and guess what?
We kind of know who.
All of it's verifiable. You know what they were contesting? The fact that we told you how many were in the ICU.
Yeah.
And how many were in the ICU, exactly how much we said. What's infuriating more than this, right, is the Joint Information Center has yet to acknowledge that the Chukis community is in pain. The Chukis community is scared out of their mind. So, the Joint Information Center should just change their acronym to the CDC because they are full of shit.
Oi. Okay.
Doc, we did have Cass
Nakamura.
From the Chukis Association of Guam on yesterday to give a message out to the community because you're right. They're very concerned about the spread of COVID-19, and they wanted to just put the word out to remind everybody to do the things that help avoid the spread of this disease. But going back to what Sabrina said, Doc, it is very frustrating when we get these messages. And of course, as a legitimate media source, we want to vet the information. We want to make sure it's accurate. But the problem is we hear it from so many different people. But when we take it to the government officials, they shut it down and they say, oh, don't share verified messages. And then we find out 2-3 days later that those so-called unverified messages are actually true. Mm-hmm. It's frustrating, and I don't know if we're
like
just
they're not in the intensive care unit, but they're in the COVID care unit 3, receiving intensive care level unit care.
You see how confusing that is? So if you ask, oh, how many are in the ICU? And they'll be like, oh, nobody's in the ICU, but they're receiving ICU level treatment in another part of the hospital. But hey, that's not the ICU. And I just think it's a little, it's disingenuous.
And then they say, let's not talk about it, even though one of the parameters, right, for us being able to safely reopen our community is going to be how well run are our hospital beds, and especially our ICU beds. Mm-hmm. If you notice, the JIC or whatever the hell their name is they never mention how many hospital beds we have or how many ICU beds are being utilized, because every time they do, they have to acknowledge that we fail. On a national level, our community fails. We're full. Our ICU beds are full, not of COVID-19, but from people that have been playing around with ice and have blown out their brains, and so they have these massive strokes, and we have to try to save their life. They're full because people are on dialysis and they've got some weird infection that we need to save their life. They're full because people are having heart attacks. It's not a good time to have COVID-19. And so the JIC needs to get off their butt this morning, and I hope they're peeing in their pants again, because they're being called out. You're not telling the people of Guam the truth. Our hospital situation is critical to us reopening safely. If you're going to let the children go to school, if you're going to say everything's fine, then be honest about the hospital situation. What is your plan for the surge? What is your plan when 10 more ICU patients come in to keep company? The one guy who's been in there, ever since it got leaked out by the Chukis community themselves. The Chukis community are themselves speaking about this. This is no secret.
Right.
This is not a HIPAA violation. This is nothing like that. HIPAA has no C in it. HIPAA means information portability. It's designed to help share important medical information so we can save lives. This government is acting like a bunch of Gestapo communists using information as a weapon. They don't want you to know the truth. And they're muzzling our media, KUAM, from getting the truth on the day it happens. So you have to hear about it as a rumor 2 or 3 days later and then get criticized for asking the tough questions. Why didn't they just give you the answer on the first day? But again, this is about, the media needing to realize that, they don't like you. They don't want you to tell the truth.
Oh, I realized that a long time ago. I don't give a damn. I ain't here to be liked.
Christian,
I don't give a damn. Actually, I prefer it if you hate me.
If you get a good haircut like me, they like you.
Yeah, all right. I'll let it grow out a little.
I wanted to ask though, because you were criticizing the legislature, the administration about not hiring nurses and medical professionals. What would your response be that there's a shortage, that it's it's difficult to hire nurses because there just aren't any out there?
Then why did they have 2 emergency sessions about a stupid election, a primary election? They haven't had a emergency session about trying to find nurses or contact tracers or anything to do with the pandemic. I don't know what the answer is. Oh, actually, I'm sorry. I know what the answer is. Let's vote a whole bunch of new people in, because these guys don't know what they're doing.
Okay.
Next question.
All right. Oh, man.
Well, we've got the budget chair coming on.
Yeah, so we'll ask him.
Yeah, if there's crickets, and I hope the budget chair is listening, right? We need contact tracers, and we don't need to rob the general fund. There's $4.4 million in federal funds that Guam has already received for testing and contact tracing. And we have businesses now scrambling, trying to find money to test their own staff, being told by JIC that that these tests won't get paid for by the government of Guam because it's for business purposes. What do we pay the GRT for? For the privilege of doing business on Guam? Or is it for the privilege of the budget chair having slush money so he can keep 5,000 non-essential employees going on during the middle of a pandemic? You're an idiot. Bring them on.
Thank
you, Doc. Yeah. Well,
okay.
Thank you so much for coming on, Doc. Love the hair. Thank you for the fiery words. And he's
keeping it real.
Sorry about the roosters. All my roosters are waking up.
They're crowing right along with you. Yeah, so Doc,
they're mad.
I appreciate it.
They're mad at the budget chair. Tell them they're mad at the budget chair. Now that they're unemployed, they didn't get no stimulus. They lost the cockfighting bill. All right, guys.
Thank you, Doc.
Thanks, Doc.
Yeah, don't take no for an answer and quit getting muzzled.
Stay safe.
Wash your hands and your thumbs and wear your mask. All right, Dr. Vince Akimoto. Yeah, it's frustrating, and of course he's talking about this. There was messages going around, and we were slapped on the hand, and we were told, "Oh, don't share this unverified information." How dare you? Only share official messages that take 5 days to come out. Information failure all the way. Unfortunate. We just talked about this yesterday. He's right. They use information as a weapon. They hold it and they try and make you wait it out. And I think the thinking is that, if we just don't answer it or we say it's a rumor 3 days, it's just going to go away. Yeah. And specifically with this incident, we had the Chukis Association of Guam on them. They were saying it themselves. When we asked Dr. Maglonia, she said, hey, if they're telling you guys, then it's verified. But why do we have to wait a week and a half to hear it from our government? That's the thing. If we're really trying to save lives, then we need to hire these contact tracers. And, Dr. Akimoto's right, is the contact tracers a lot of times aren't coming on the same day. You know what I mean? They don't, we're getting the positives and we don't have enough contact tracers. I mean, well, we got them coming on in a bit, and I'm sure they heard that call. So we'll get Annette Uggan and Vince Uggan from Public Health's Contact Tracing Division. And we'll keep it in the Zoom room now and move on, switch gears a little bit from Island Girl Power.